Lisa Wheatley, Programme Manager for Bristol Health Partners. Thank you.
Thank you. Thank you, Emma. So yeah, as Emma said, I'm just going to give you a really quick overview about Bristol Health Partners and also just tell you a little bit about our health integration teams, or HITs, some of which we have presenting for us today. So the Bristol Health Partners collaboration has been in existence since April last year. That's when the collaboration agreement was signed. We currently have 9 partners, and those are the 3 NHS trusts in Bristol, the 3 CCGs, the 2 universities, and the local authority, Bristol City Council. So you can just see them listed there for you. The trusts and the universities are committed to Bristol Health Partners for the next 5 years, and that includes providing some funding, which is great news. And so we have a core team of people which is made up of individuals who are seconded from these partner organisations. And that team consists of, we have Peter Matheson, who's our director. We have our Chief Operating Officer, Dr. Mary Perkins, who some of you might know. Then there's myself as Programme Manager, and we have a Communications Manager, Zoe Trindawidis, who is in the audience over there. And we also now have an Evaluation Officer who is hosted here at APCRC, which is Trish Harding, and she's just sat at the back there. And we have an admin post which is vacant at the moment. So what are we trying to achieve? This is our mission statement. Basically, what we're trying to do is harness the talent that we have here in Bristol to improve the health of the people who live here. And we aim to do that by using the best evidence and the research that we have here to drive changes and improvements to service delivery that's needed by the patients and based on clinical input. So we will work together, because working together we can achieve things which we can't always achieve as individual organisations. For example, the recent successes of the Clark West bid and the AHSN are due in part to the existence of the Bristol Health Partners collaboration. There's also a role for Bristol Health Partners as a senior leaders forum, so it acts as an overarching group which can lead and coordinate activity around health in the Bristol area. So the main vehicle that we've used so far to try and help us to achieve our aims are our health integration teams, or HITs. And these are basically virtual teams of people that come together around a particular health topic or disease or care pathway and work together to try and improve things for patients. So they're often people who wouldn't normally talk to each other, who are from different parts of the healthcare system. So it involves multiple organisations. As many of the partner organisations as possible should be involved in each team. They cross disciplines and they cross professional boundaries. Obviously, commissioner involvement is key, hence why this meeting today is so important. And we try and make sure that all of our HITs really are linked in with fully linked in with all the relevant commissioners for their area. Patient and public involvement is something, again, which runs through everything that Bristol Health Partners does and everything that the HITs do. So we try and make sure that that happens. And we also recognise that evaluation is key. This is perhaps something which we haven't done too much of yet. But as I said, we now have Trish, our evaluation officer, who's going to help us to make sure that everything that the HITs do has evaluation kind of embedded into it. So what are the benefits of becoming a HIT? It's certainly not for the funding, because Bristol Health Partners does have a small amount of funding, but it's not a great deal. So we can give each HIT around about 10k just to help with the cost of meetings and things like that. And of course, as of January, the HITs will be able to apply to the Clark West project for support. But the real benefits come from the fact that being a HIT gives people a voice that they might not have had previously, and it tends to open doors where they might previously not have been open, and it helps to provide a kind of critical mass. And also the process of becoming an accredited HIT, we hope, is useful for these teams, because it really does force people to have those conversations with commissioners and get the right people involved, and also to make sure that they have well-developed PPI plans from the outset. So we have 10 existing HITs at the moment, and they're just listed here for you. And you can see that they're from a wide range of areas. We have musculoskeletal, self-harm, supporting healthy and inclusive neighbourhoods. So Each of these hits is sponsored or hosted by one of the partner organisations, and what that does, hopefully, is that it demonstrates the level of commitment to unblocking barriers to change. And there's also an expectation that the host or the sponsor will provide some kind of support for that hit, whether that be in kind or in cash. So this slide just shows the hits that we currently have in development. We have another 10 hits which have passed the EOI stage, and we're just waiting for them to submit their full applications. So, for example, the chronic kidney disease hit, their full application is going to be assessed on Friday, actually, this week, by our review panel. And the Bonnie, the Child's Health Inequalities hits, they're going to be assessed in December. And then we expect the rest of them to kind of trickle through early next year. So normally at this point I would go on to tell you a bit more about some of the hit successes and some of the activity that they're carrying out at the moment. But because we've got some hits presenting today, all that's left for me to do is to let you have our web address. So it's www.bristolhealthpartners.org. So if you'd like to get involved in any of the hits that I've talked about today, or if you'd like to know more, or if you'd just like to know more about Bristol Health Partners generally, then please do get in touch with me. There's my email address and my mobile, and I'd be really, really pleased to hear from you. Thank you.
Thank you, Lisa.